My name is Stephen Blythe. I'm a board-certified family practice physician. I've been practicing for slightly less than 4 decades. Vaccinations are designed to stimulate the immune system, and so a common response to vaccines, while sometimes people won't have any response or maybe they'll have a sore arm, it's not unusual to have a reaction much like you would have with an infection. Usually it doesn't last as long. I have had no patients that have had significant side effects from the COVID vaccine. I have had a number of patients who have died from COVID. And so when I hear people say that it's not a real problem, I'd like to introduce you to the family members of my patients who died from it. Like a lot of people who died from COVID, most of those patients had other risk factors. So certainly patients who are older, patients who are obese, patients who have diabetes, patients who have heart or lung disease, absolutely need to be vaccinated against COVID. I think it's a good idea for everybody to be vaccinated against COVID, but those are risk factors that make it more likely that you end up in the hospital and even dying. I think one of the most important resources for our patients is actually our providers. They can call us if they have an important question. If they're on the portal, they can send us a message. Certainly when they're in for an appointment, they can raise questions with us. All of the providers here are very highly trained and experienced. We're more than happy to answer questions for folks, and we can kind of help sort through the information that they've found from other sources to help them determine what is maybe the most reliable information for them. There's other vaccines other than the COVID vaccine that are very important, and for years we've had vaccines against pneumonia, and that's probably the most important vaccination for older adults. The vaccine, and there's new versions of that are even more effective. The problem with pneumonia is that the bacteria that cause pneumonia will get in the bloodstream, and if they get in the bloodstream, then you die very fast. And the vaccinations against pneumonia help fight off the bacteria if they're trying to get into your bloodstream. They may help prevent you from actually having pneumonia. They most definitely prevent you or help prevent you from dying from pneumonia. Sometimes in a population where a lot of people haven't gone to the doctor a lot and relied on the doctor a lot, sometimes building trust is very important, and sometimes that takes time. And meanwhile, trying to help somebody get their blood pressure under control and their diabetes under control can be a challenge. We can do what we can. We can make sure that they can get the medications that they need. We can make sure that they get the education that they need. We have a diabetes educator. We have translation services for those like myself who don't speak Spanish, for instance. So we do everything we can to help people get all those other risk factors under control and hopefully live a better and longer life.